Good afternoon, everybody, or good morning. For some of you, maybe even good evening. Welcome to our webinar from the Global Center for Healthy Workplaces, Advancing Mental Wellbeing During and Post-COVID-19 with a Holistic Strategy. I'm really excited. I'm Wolf Kirsten, first of all, and I welcome you from Berlin, Germany. Also have Tommy Hutchinson from London as a co-moderator on, who will be leading you through the discussion later. And really glad today, really happy we have three excellent speakers from three great companies from three different countries. So it's going to be really interesting and insightful, I'm sure. So mental health, mental well-being is today's focus. And as you all will know and have worked in, it's becoming a major challenge, or it already has pre-COVID, and now I think it's becoming a real challenge for many companies and, of course, employees in terms of navigating, moving through this difficult period that we are still in. Number of surveys have come out documenting the impact of the current crisis on mental health, including the increase of anxiety and depression, and you will hear this from our speakers. So employers are really taking a close look, and in some ways are scrambling to find a good solution or ways to help their employees move through this. So as I mentioned, we will highlight three different companies from three different countries. So we have Brazil, we have Denmark and the US, but I should say that we have two multinationals which are really all over throughout the world, the global companies. But our first company is the Hospital Albert Einstein in Sao Paulo, Brazil. And as you know, healthcare workers, at the front line, very much challenged in this situation, of course, the mental health as well. So we're really excited to hear from our colleagues in Brazil about this to start off. And so our first speaker is Luiz Gustavo Zoldan. And Luiz is a psychiatrist, and he is in charge of the mental health program at Albert Einstein Hospital, again, in Brazil. So let's get going. I will share my screen with you, and we'll start with the presentation. Luiz, go ahead.
Okay, thank you. Hi, everybody. So let's talk about Brazil and Hospital Albert Einstein. Let's just wait for the presentation.
Yeah, 1 second. Sorry.
Okay, thank you.
Here we go.
Perfect, thank you. Next. So I brought you here a little bit of Albert Einstein so you can recognize how many employees do we have. So I brought some analysis made before the pandemics here in Brazil. You know that in Brazil we have around 1 million infected people, and we have about 51,000 deaths at the moment. So we're not in a good moment. But in Albert Einstein we have in São Paulo and in Albert Einstein, we have less cases now in the curve. But previously, the pandemics, we had this analysis, and it's based on information from more than 12,000 people from SHIBAE employees, and we have this pyramid according to mental health complaints. So we know that 35% of the employees had some concerns about their mental health, and so that ones that respond positive for some symptoms, they were directed to answer the PHQ-2 questions for screening for depression, and then we had that 1,431 employees had some symptoms of depression. So it was a little bit concerning. It's according to literature, but we knew that we have something to do about it. And here under you have a questionnaire that we're putting now for the employees that are coming back to work. In Albert Einstein, we have like 1,000, a little bit more, employees that had the COVID-19, so they are coming back to work now, and we made some questions about their performance-based activities, lifestyle, and screening for depression and signs of post-traumatic stress. And this preliminary results shows that we have 55% of symptoms of PTSD, and we have 27% of the employees for screening for anxiety positive, and 19% of screening to depression positive too, and 15% of insomnia. So at the beginning of, next please. At the beginning of the pandemics, we started thinking, and we read a lot about the guidelines and the protocols that showed probably the mental health. It was going to be an issue for the frontline teams. So we developed this initiative that we called OUVID. OUVID is an acronym similar to COVID, but it means in Brazil ear. So we're talking about hear people concerns, hear their problems. And it's an institutional response to promote mental health prevention and treatment of mental health problems related to the coronavirus pandemic at Hospital Israelita Albert Einstein. So we developed a big program that has some actions for all of our employees, not just for the frontline teams, but for all of them. And for all of them, we developed some promotion of self-care strategies, like a platform where we have some videos and some audios for relaxing, for meditation and lifestyle. And we have many internal communications. For the frontline teams, we developed some local actions, like local relaxing activities with body and mind practice that are recognized in the articles. We have the talk wheels at their during their shift, and training and qualifications. And for those with psychological stress symptoms, we developed a psychological support based on a hotline and an on-time psychological phone service. And for that had some problems detected by this hotline, they were directed to a brief psychotherapy, 3 to 6 sessions. And for those with previous mental disorders or detected with high risk of mental disorder related to SARS-CoV-2, we have the medical care with a teleconsultation with a family doctor or teleconsultation with a psychiatrist. It's important to say that in Albert Einstein we have primary healthcare center for all of our employees and their dependents. Next. So we divided the pandemics into 3 stages. At stage 1, at the beginning of pandemics, we started structuring the OUVID initiatives. So we detected the feeling of inevitability of the crisis, the overvaluation of the pandemic, so the imagination of the worst scenarios, or under-evaluation, the empowerment of personal characteristics, positive or negative, and anxiety, fear, tension, insecurity, and obsessive surveillance of the symptoms of this disease. So we started meetings with the leaderships to help them with the awareness of the decision makers. We had to the establishment of partnerships with many departments, formation of multiplicator teams around all the departments too, formation of work fronts with the hotline OUVID and psychotherapy online. We have the creation of the OUVID platform and adjustment of existing psychosocial care network for this moment specifically, and information and awareness of our leadership of the areas. Next. At the second stage, during the pandemic, we started and started to get some calm, resilience, hope, safety, and social connection. So we detect the fear of contamination in the family, fear of not having access to detection of tests. Here in Brazil, you know that we have some concerns about it too. Feeling of loneliness, vulnerability, and impotence and loss of control, crying, anxiety, panic, anger, risk of eating behavior, risk of abuse of alcohol and cigarettes and other drugs, psychosomatic complaints, acute stress disorder, post-traumatic stress disorder, decompression of pre-existing, decompensation, sorry, of pre-existing psychic disorders and adjustment disorders. So because of these concerns, we try to get in all of these issues. So we started doing meetings with local leaderships again to present the program. We created the OUVID moment, so it's this relaxing moments with many strategies like provoke body-mind relaxation responses in frontline professionals, resulting in decompression and centering through body awareness techniques, stretching, guided meditation, and deep breathing. And it's done in 5, 10, 15 minutes on their shifts too. We had the talk wheels, weekly meetings of frontline professionals with a psychologist or psychiatrist that are made at least four times. The hotline I told you, the brief psychotherapy that I told you too. We had the telemonitoring, so all these patients all these employees that we had in this program by telemonitoring. And we had the OUVID platform too being accessed, so we have more than 3,000 access to this platform. And some capacitations. We participated from many trainings, talking about non-violent communication, talking about intelligence, emotional intelligence, balancing, and all these issues to help them to cross all this pandemic and these changes happening around happening in Brazil. Next. At stage 3, we are not in this stage. Now we are in stage 2 at this moment in Brazil. But the stage 3 is ending of the pandemics, is the ending of the pandemic. So we will work with the identification and treatment of mental disorders developed or worsened during the pandemic, linkage to PHC, sustainability of mental health and psychosocial care actions created during the pandemic. So we know that the response to COVID-19 pandemic is a marathon, not a sprint. So when a global disaster of this dimension occurs, with more victims than in the fire of Botquis that happened in Brazil, or 11 September, or Brumadinho that happened in Brazil too, the emotional response of those directly or indirectly involved usually occurs in phase. So we divided it in phase. And the stage 3 is the phase to treat them. We think that we are going to another level now, that is about treatment of the patients now. Next. Just for you to have some numbers. So in the digital front, we have more than 70 videos, podcasts, and infographics, lives on YouTube, lives of Wellbeing to the institution, and more than 3,000 access. At the hotline, more than 200 access, around 100 patients on brief psychotherapy now, and 44 patients with consultation with family doctors or psychiatrists. We have more than 1,500 attendance on relaxed moments and talk wheels, and we have more than 1,500 attendance at the trainings. We had some feedbacks with the hotline. We have that they have a resolutive conversation with a score of 8 from 1 to 10, and 97% of employees who use the service related it as a very good or excellent service. At the talk wheels, we had 84.9% rated this space as a safe space for speech, and more than 80% related the service as very good or excellent. Brief psychotherapy, the same, and 100% of the employees who use the service rated it as a very good or excellent service. And relaxing OUVID, it was scored 7 or more, and 93% of the employees who use the service classified it as very good or excellent. Next. And we have some pictures showing you some of our activities. So we have the relaxing moments, even at the presence or online. We have this talk wheels too, online too, and we have the practice inside the contaminated areas with all the protections too. Just to show you how we do this, some of these actions. Thank you.
Thank you so much, Luiz, for the comprehensive overview in this short time you had, a comprehensive program rather. So thank you so much, and we'll keep moving. I already see that we have a number of questions coming in, and some are already being answered at the same time. So really appreciate it. But keep the questions coming in the chat function. And I'll move to our next speaker, because we have another 2 great programs coming on. So our next speaker is from Novo Nordisk, from the country of Denmark. And Novo Nordisk, as you will know, is a pharmaceutical company, the global company. And Nadia El-Salanti is our speaker, and she is an organizational psychologist and principal scientist at Novo Nordisk. So Nadia, please go ahead.
Thank you. Thank you very much. I'm going to talk a little about how we have been supporting our leaders in Novo Nordisk during this global pandemic. If you take the next, just to give you a brief overview of what Novo Nordisk is. We are a global pharmaceutical company. We are mainly in the fields of providing insulin. So obviously under this crisis, we needed to have our facilities running, because there are millions of patients that are depending on our diabetes and hemophilia treatments. We are a company of more than 42,000 employees globally. We have headquarters in Denmark, but we have presence in 80 countries around the world. Mainly production and R&D in Denmark, and then in all of these regions and countries, we have sales forces. Next. So I just want to say, in my role in the company, I'm sitting in the health and safety department, where I am responsible for our mental well-being programs. And we have been working on mental well-being, and we've kind of established a paradigm on how do we understand mental well-being in an organization like ours. So our approach is that we believe that mental well-being is closely related to the psychosocial working environment, and we see this as a requisite for performance, as well as a significant protective factor when it comes to mental health. We also acknowledge the presence of work-related stress as an occupational risk in Novo Nordisk, and we acknowledge that it's our responsibility as an employer to both manage stress and risks at our workplace. We've been working on this for many years now. I've been with the company for 7, but there's been a long tradition on actually working with this. We are monitoring the level of symptoms of stress, and you can take next, among our employees. And as you can see here, we are using a validated single item measure in our employee engagement survey, where we are defining the symptoms of stress, and then asking the employees, are they experiencing this? So we have this high level information on whether they are experiencing psychological distress at the workplace. We started with a baseline with 20% of our employees experiencing to a high degree symptoms of stress, and we've been working systematically to improving the mental, or the making a more healthy workplace, improving the working environment at all levels, individually, group, leadership, and organizational level, and have managed to decrease the share of employees each year that are reporting symptoms of stress. We still have in 2019 14%, and obviously we don't have numbers now, but it will be very interesting in September when we run the next survey to see what does it look like post or in the midst of COVID-19. Next. So obviously the COVID-19 situation has changed a lot of things for our employees. Emotionally, there's the uncertainty about the future. That is a big risk factor, we know from studies. The fear of contamination, which is a very real fear, the loss of control that we all are experiencing, and then of course raising concerns. And then on work-wise, because really the entire company has been running, obviously we have had people working at the factories in the production side, but many employees were sent home and needed to work from home. So lots of changes in the way that we organize and do work. So we are acknowledging this. We are telling our leaders this is the situation. And if you take next, then we have focused on actually, we've done a lot of things, but I'm going to talk about what we've done for our leaders. So really stating that employees, they need leadership, perhaps even more now than ever before in a global crisis like this. So we have we needed to, on a very quick note, to customize and develop some tools and guidance for our managers on how do we then lead from a distance while still ensuring the mental health of our people. Next. As the previous speaker also talked about, we are also looking at different phases, and there were different needs in the different phases. So obviously the phase 1 is within 2 to 3 weeks of the lockdown of the countries, where here really the focus in this is times of crisis, and disruption of work arrangements. So here really there was a lot of energy in actually establishing new working routines and getting everything running. And from a mental health perspective, what we saw here was really high levels of anxiety and concerns, and the things that we provided from our function was a lot of guidance and tools and availability to hotlines and so on, and also promoting self-care strategies for our employees. So that was what we did there. The phase 2 was, now we've been accustomed 2 or 3 weeks into the lockdown. We're in daily operations, and for Denmark it was 2 months of lockdown. But I have colleagues in India, and they are months of no, I said 2 month lockdown in Denmark, but some countries it's much longer. So really there's a need to support the organization in dealing with that. Phase 3 is about preparing for return and having this gradual reboarding of people. If you take next. So what I'm talking about here is how do we support in this phase 2? And I just want to zoom in on 3 leadership priorities that we told our leaders that they should have when it comes to mental well-being. The first one is mapping and addressing mental health issues, acknowledging that some employees will be more vulnerable and at higher risk of developing mental health illnesses in this situation than others. The managers need to know who are their vulnerable employees in order for them to take better care of them. So if you take the next, we provided the this tool, a mapping tool, and we asked all our employees to kind of assess, all our managers to kind of assess their employee situations. So let me go to the number 2, which is the social situation. So we know that the lockdown, the social distancing implies an increased risk of isolation, or there is isolation in that. But if you're a single person living alone, not having any family close by or in the house, then you are at a greater risk of becoming very lonely. There's another risk if you are having younger children that needs homeschooling. I also saw the previous one talking about women, female providers who are taking care of both household, children, homeschooling, and work at the same time. So that is an extra stress factor. There could also be other conditions. We asked our managers to be aware if they knew of any prior history of mental health issues among their employees, prior examples of stress, depression, anxiety. These are the ones that they should be particularly attentive to, as well as there would be employees with underlying health conditions who would be more vulnerable. So their anxiety level would obviously also be higher, and then also look at in general, what is it that they need to be attentive to. So here the guidance, we provided this as a tool to kind of map out where are my employees, and then we wanted them to conduct frequent one-on-ones based on individual needs. And we provided talking wheels for that as well, how to take that conversation. Next. So the second priority that we wanted them to be very aware of is aligning expectations. We talked to our leaders, explained that aligning expectations is also very important now under these changed working conditions. So there was a slide on why is this particularly important, and then we talked about the need of actually verbalizing and being much more specific on what do we expect from the employees, how much do we expect them to deliver and perform on their work tasks, taking into consideration the previous slides on what is their particular situation. So much more individualized approach to employees, taking their situation into accounts. We made a tool on how can they do this in a good way, and if you take the next one, we also encouraged the employees and managers to kind of map out their tasks and assess all the tasks that the single employee has and assess them towards whether the degree of urgency of completing with the task, but also compared to the degree to which the accomplishment of the task was affected by the COVID-19 situation. Obviously, we have a large sales force that are out going physically to hospitals and visiting doctors in order to sell our products. They could not go out and do that, so we wanted the managers also to support their employees in doing this in a different way, more virtually, but also to lower the targets and consider what should the compensation be like, because that is also a stress factor. So we found and got a lot of great feedback on this. Many also maybe office-based, they thought, so now I'm just working from home, we should just keep delivering what we did under different circumstances, but there were a lot of things that were much more complicated. So having this as a tool for a good conversation between employee and manager is helpful. And then if you take the next one, the third priority we wanted them to focus on is the importance of engagement and well-being in the team, making sure that we still kind of have focus on team coherence and engagement and well-being there in general. These are psychosocial factors that we are used to working with: influence, social support, meaningfulness, recognition, predictability, and balanced demands. And for this purpose, we kind of twisted them and provided some guidance on, so how can we work with this in the team, but from the distance. So there was some specific guidance and help on that. If you take the next one. I don't know, 10 minutes is very short, but this is my last slide. So obviously also the last thing that we encouraged our leaders to was to put on the oxygen masks themselves, take care of themselves before they could take care of their employees. So we like this picture from the aviation industry. So there were some tools and guidance and support to leaders on how do they ensure that they are actually themselves mentally fit for the job, so they are able to take care of their employees. And we also encourage senior leaders to actually have that attention to their leaders and supporting them in this new role of remote working. That was it, I think. Thank you for listening.
Thank you, Nadia, very much. Very insightful. The role of leadership, obviously, so important. Okay, we've got to move on. Our next speaker, we're going to move over to North America, to the US of A, Jonathan Gelfand. And Jonathan is the Global Wellbeing and Health Promotion Manager at a small company called IBM. So, Jonathan, please take it away while I stop the presentation.
Thanks so much, Wolf. It's great to be here with everyone. Luiz and Nadia, thank you. It's an honor to present along with you and talk about what I think is the most important topic, the mental health and well-being of our populations. There is a phrase that we use here in the New York metropolitan area, and Wolf, if you advance the slide, you'll see it. How are you doing? It seems like a simple greeting, but I'm from the New York area, and we say, "How you doing, huh?" Like that, and it's less of a question and more of a salutation. How you doing? But I think that during this time of coronavirus, we're asking the question and we're pausing to listen. I think all of us are at our organizations, whether it be with your colleagues or your friends and family, and we pause to give that moment. And I think that this is what we've been doing at IBM, having real conversations with gravitas, things that matter most to people during this time. And I'm really pleased to talk about some of our efforts around that. So here's an informal question about how you're doing. We also do it in a formal manner as well. And on the next slide, you'll see that we've instituted a regular pulse survey. Every other week, we're checking in with our workforce around the world. We have over 300,000 employees around the world in our small little startup that Wolf was referring to. And we're asking a few questions here. How are you doing? Do you have the support that you need from your management? How are you able to do your job? How are things going? And do you feel like you have the mental and emotional well-being support in place? We alternate to include managers in this inquiry as well. So every other pulse survey, managers are asked to respond also about their team. And this is a great initiative that's really led by our engagement, diversity, and inclusion team that allows employees to feel that they can amplify their voice and be heard and also listen. Managers can listen and take action and understand because they get some reports, anonymized reporting, but they can learn themselves, and our leadership development team uses the content to help our leaders understand the issues, and we work on empathy, emotional support as well, and that's a really critical skill. And then our leaders are able to get a toolkit, a dashboard that gives them information by region that helps us as well. Our benefits and corporate health and safety team are able to leverage this information to know where we can make an impact, what key issues are as well. And we're taking this question set even further. In fact, later today, we're conducting a virtual focus group with hundreds of employees engaged to understand about behavioral health benefits. Where are their barriers? Where may they be challenged both in obtaining care, access, stigma, costs, but also culture at IBM? What do we need? Where would they indicate that we should be investing? We are absolutely committed to this. And Wolf asked us to speak about where do we go next. And I'm going to cut to the chase in what happens next post-COVID. At IBM, we've been committed to workforce well-being and have really put in place programs and support and tried to build a culture around that. But in some ways, I think that the concept has still been slightly peripheral. That is, it's a benefit. And it is being really embedded within our culture more and more. And this issue has brought it to the surface right now. And our leadership development team, diversity and inclusion, as well as comp and benefits leaders feel so strongly that it is kind of at the heart of our culture at IBM moving forward. And this has been an important inflection point and a reminder about this. So that skips ahead to the conclusion about where we go. But I want to share that because right now we're able to see what is going on to support this. Our digital resilience solution in the United States is offered through Equilibrium. It allows us to do a scalable cognitive behavioral therapy, positive psychology program that's evidence-based for our workforce. It enables them to go on their own journey around their resilience and well-being, and if they show high risks, they can get pointed to other resources. We saw in this time that that stress, high stress, increased from almost 17% to 27% in Q2. So it coincides with the coronavirus in the United States. We also saw that when new users were using the application, there was increased risk for anxiety, burnout, depression, and sleep issues. This gives us specific insights about topics that matter and the conversations, how you doing, that we should be having and the programs that we can put in place. Next slide, please. We've been engaging in bi-directional conversation with IBMers. And here's an example of one. We've launched Slack channels at IBM to have that dialogue, not just from our leaders, but also the groundswell from our workforce. And we do conduct sessions where we'll have a leader of the organization along with a clinical team member or resilience team member address certain topics. We'll dedicate a period of time to do Ask Me Anything sessions. And it allows not just the leader to share what's important, what matters around mental health, but IBMers too. And so they're sharing personal experiences, real issues that they're facing, whether it be access or crises themselves. But we're able to create community around this and support one another. And I think that it's been a part of what keeps us connected and part of that, really important cultural piece that I spoke about. Wolf, next slide, please. We have been forced, as many of you have as well, to identify new channels to communicate with people. You may be overwhelmed by email. We see each other or our own face. I mean, I can't believe how much I've aged, or maybe perceive that because I'm standing in front of the screen so much. But we are focused during this time on a few critical things. We wanted to close gaps. In fact, we had some gaps around EAP around the world, and I'm pleased that our partner Optum was able to help us close those. We're raising awareness and ensuring that IBMers around the globe and their family members have access to that care. We're raising awareness around benefits. We have expanded telebehavioral health supports, included chat and talk space for our workforce. We expanded the number of visits that are available to people through the EAP. We increased that number, and we removed any barriers around costs for behavioral health care as well by removing the co-insurance and deductible for telebehavioral health care services as well. But we've done those to address access, but we've also, continue the conversation because we have to address the air tactics, which are the benefits that happen outside our walls, and the ground tactics that happen in our interactions with one another. And so we've been having real conversations. How are you taking care of yourself? About resilience. Are you more stressed than usual? And what we're doing with these conversations is also to get a top 10 list from IBMers to share with one another. And we've used those in news stories that we do every week to keep the conversation going. We leverage technology called Mural to do collaboration. We cannot do whiteboarding anymore face-to-face, but Mural allows us to do this virtually, and we create whiteboards about resilience, around mental health as well, and we found it to be really helpful. And in fact, the connection between our business resource groups and our subject matter experts has yielded some terrific results. And and I guess I would refer to a Reese's peanut butter cup. You put the chocolate and peanut butter together and you get something fantastic. And I think that we're really onto that here in advancing our culture. Next slide, please. We've been asking because we want to know, and we're hearing that 2/3 of IBMers are struggling to find time to get up and exercise, incorporate during that during their day. Many of us are sitting at our computers often, and so we have begun to introduce regular workout Wednesdays, chair yoga, stretching, and we conduct these sessions throughout the week. In fact, yesterday was International Yoga Day, and we're doing something over the course of this week where it's led by grassroots efforts of IBMers who are leading mindfulness sessions, yoga sessions, nutrition topics as well, and you can access these throughout the day. It's about building community. One of the things that I'm incredibly proud of is that 88% of our workforce indicated that they know how to access resources to support them in their mental and emotional health needs. This was a key priority for us because there's a lot of noise out there. There's a cacophony, and we wanted to drive home, what the resource is, what the benefit is, and how do you get it. We also understood from IBMers what their key priorities were, and here are some of them, so that we're able to partner with our EAP, Employee Assistance Program partners around the world to deliver that content, and we're also able to create bespoke content for our workforce. Next slide, please. Again, I'm highlighting something here that was created by IBMers. This was not a leadership-driven pledge. IBM asked, and IBMers came up with a series of pledges during this time that have to do with how we behave toward one another and how we take care of ourselves. And this has really been a really critical support for our workforce. And you can come back to this, and it's a reminder for employees and managers, and it's okay not to be on camera. We understand that, and we support that as well. The last slide, please. I wanted to sort of reaffirm our commitment to IBMers around mental health. I've said that nothing is more important than the mental health and well-being of our workforce. There may be things that are equally important, but IBM actually came out with our formal commitment last year around this. And we used World Mental Health Day to do that. And it's not just platitudes here. I think that we're demonstrating that through the kind of behavior that we have with one another, through the actions that we have during COVID-19, or the racial unrest, as well as LGBTQ issues that we're facing as well. It's about supporting one another, accepting people, addressing stigma, creating a safe environment, removing barriers for people, and helping people to thrive. individually and collectively, because we all benefit in this case. We have commitment from our top leaders, and you can see videos here, but again, it's not just the leadership where we have commitment, it's commitment to one another, and we have videos from IBMers too who are coming forward to share and have real meaningful conversations about how we're doing. Thanks, everybody.
Thank you, Jonathan. Really appreciate it, especially the New York accent. I had a chuckle about that. So, so thanks to all three speakers for taking time in the busy day. And I'm going to hand it over now to Tommy Hutchinson in London to facilitate the discussion. Tommy, please go ahead.
Thank you very much. And these have all been fantastic presentations. I was wondering, was that a New York accent or a New Jersey accent? I'm not sure which. But if you have a question, there's a real debate going on superbly in the chat box. But if you have a question, please indicate, and I will be very happy to take you. We don't have too long, but while you're thinking of your question, I have a question both for Nadia and for Jonathan, different questions, and Luiz, feel free to chime in. My question first to Nadia, and I'll immediately then also tell Jonathan his. Nadia, there's a very interesting slide in where the stress level was higher outside Denmark. I've worked in a bank when the head office stress level was much higher in head office than it probably was anywhere else. You seem to have got the trick the other way around. So I'm just curious why that's the case. And Jonathan, related maybe to what's been happening recently with the Black Lives Matter movement, and way before that, the Me Too movement in Hollywood and so on. Here in the UK, with coronavirus, South Asians are massively more likely to be infected by coronavirus. Now, we don't know how that affects mental health yet. But do you, at IBM, are you beginning, I mean, maybe you do already, or are you thinking about it, to measure perhaps different ethnic groups? Maybe in some countries you're not allowed to do that. I think possibly France, if I'm right. But is that something that you consider doing? And Luiz, feel free to chime in as well. But I'll take Nadia first, and then Jonathan.
Okay, thank you. So I think the reason we see these differences, that there are different reasons. One of them is due to the composition of the workforce, that there are different. So in our headquarters, and it's actually in Denmark, almost half of all our 42,000 employees are based in Denmark. But it is the staff functions. It is much of the production facilities are there. So traditionally, our operators in manufacturing, they don't have that high stress levels, and then outside of Denmark we have the sales forces, and they are one army people that are out on their own. So there are many risk factors there. They have very high sales targets. They are on their compensation is based on also they get a bonus if they reach the targets and so on. So there's another stressful environment. And then they are obviously operating in Iran. We have a big community there in Brazil. There are many different also socio-economical things that are playing a role here. That was one of the reasons, and then another one is actually, and this is backed by the progression that we have seen, the improvements we have seen, that the business areas who first started to actually apply a systematic approach on identifying psychosocial risk factors and mitigating them, taking the stigma out of stress, teaching leaders and so on. That started in the Danish-based areas, business areas. So when the first assessments we made, there were not that big a difference between Denmark and global. But as you see, the difference, it becomes bigger and bigger, and that's because there's also a delay in the results. But we see out globally, actually, if I take Iran again, which is obviously under extreme pressure of all sorts, they have worked systematically with this for 1.5 years, and they are succeeding in bringing down the stress numbers. results. So if you pay attention to it, if you work systematically with it, and legitimize the talking and the dialogue around it, then you can create results.
And Jonathan, would you like take up the question on, let's say, ethnic monitoring and so forth?
Sure. Tommy, I kind of interpreted your question about that this way. We're absolutely evaluating social determinants of health. That is, how does where one lives, the environment, the background, impact delivery of care, quality of care, access to care, or perhaps even biases or unconscious biases toward those people. And so we are aware of that, and I can say that our team in Watson Health evaluates that distinctly, and IBM is toward leveling the playing field. We want to advance this not only in this area, but we will sometimes use the stature of our company to advance the delivery of healthcare or social issues in countries where we believe we can raise the bar. And we're so absolutely committed to doing that.
Terrific. Thank you very much. And Luiz, feel free to chime in at any of these questions. But I'll open it out. Who would like to come in? Luiz, have you something to add? Yes, please do, if you wish to.
Well, I was just thinking that about what they said, and it's absolutely similar in Brazil, and we work with health workers, so we have one of the highest risk environments at this moment in this pandemic, and so they were really stressed, and I think that's why they seem to have PTSD symptoms higher than literature. And in Brazil, we have some inequalities, social inequalities that are extremely important. So it makes a real difference between who lives and who dies here in Brazil. And we see this inside the hospital, and we see this outside the hospital, because Albert Einstein has some governmental units that we make the administration. So we see really different scenarios inside Albert Einstein and inside this other unit. So I think it's important to pay attention at this too.
Very much. Thank you. A number of people have been asking questions online and making points. I noticed Salim had asked some questions earlier. Not sure you got your answers, but if anyone would like to come in, please feel free to do so. The open house now for the short time we have.
Tommy, we have a question from, I think, from Hauska from the ILO. Do you see that? Maybe.
Yes.
Oh, sorry. Maybe I don't see some of these, but
yeah,
yes,
maybe
wonderful.
It could be, yeah. Hauska,
Thank you. Yes.
Go ahead.
Yes, I am. Thank you so much, and thank you, Wolf, for allowing me to enter the webinar. I had some issues. Hello, everyone. This is Hauska Graysick. I'm from the International Labor Organization. It was a very interesting webinar. Thank you to all the speakers. It's really good to hear about the practical implementation of a lot of these questions on mental health. The ILO has just released our guidance on psychosocial risks at the workplace during COVID, and I'm happy to share that link with you in the chat afterwards. My question is really about some considerations for, the stigma that's around mental health at the workplace. So Nadia spoke about managers needing to recognize workers that may suffer from existing conditions. And then Jonathan spoke a bit about, the importance of workplace surveys on mental health. Many companies have been using surveys, including the ILO, asking workers about their mental health status and about psychosocial risks that they're facing. And obviously, there's so much stigma about mental health. There's even more stigma about mental health at the workplace, and this is something that we really recognize. And it's quite daunting, to talk to your manager or your human resources department about mental health issues that you're facing. And so the ILO has its own ethical guidelines for confidentiality. And I'm just curious about how companies are managing to see this balance, between respecting privacy, but also trying to understand the mental health status of their workforce. I think this is a very complicated question for a lot of employees. that maybe don't want to share the details of what they're going through, but are facing challenges. And so this is something that's come up, and I'd be interested to hear from some of the speakers about this. Thank you.
Nadia, would you like to try?
Yes, yeah, I would. Very good question. So what I showed you were guidance for leaders, but actually we had some similar that were mirroring the guidance we were giving leaders to and then targeted to the employees. So the square with the different scenarios for being of particularly risk during the COVID-19 situation were shared with the employees, and they were also encouraged to speak up. So one thing is, and they knew that the managers were aware. So it goes two ways. So both, you know, have the employees also encourage them to speak up and to dare do that. And I think I have experienced during the COVID-19 outbreak here that that it has been more legit to raise concerns and some sort of mental health issues, because, you know, we were all in the same boat, and we were all under pressure. So it became, I think it has become more legit to actually speak up and break the taboo. But obviously for Novo Nordisk, this is building on many years of taking the taboo out of mental health issues that we have been doing, yeah, in numerous occasions.
Right.
Yeah.
Thank you. Any other questions? And Wolf, do tell me if you get one. I did some work with Novo Nordisk before, and you have a very interesting structure of very kind of consensus decision making. Well, I often wondered, does that in itself create a kind of form of stress? Because, you know, sometimes easier if the boss just makes a decision, or does that reduce stress? How do you feel about it?
So actually, this is something that we've been working on improving the last couple of years. I think it creates empowerment, and it creates you know, feeling that you are being taken seriously and your voice is being heard. But of course, these roundtable discussions can become too much and does become a stress factor. But so this has been something that we've been focusing on also as part of the mental well-being program, because we realized that it does in some cases generate stress, that if expectations are not really clear, but it's you know, put out there, you find out yourself. So striking the right balance is something that we have improved, I think. But having the manager always telling you what and how and when and taking all the decisions is not good either, because you know you want to feel acknowledged and you know, involved.
Yeah, that's never worked either. So we just have a minute or two left, and all the slides and all will be shared. I'd just like to give Luiz and Jonathan perhaps just maybe 30 seconds. You might want to say something to either a piece of advice or something to reflect on. I'll go with Luiz first, if that's okay. Luiz?
Okay, thank you. What I think that is important in this moment is to hear and to give some possible ways for our employees and for our leaders to being able to speak and to really be heard, like EBM said. So I think that's the message. And about the confidentiality, it's important to have an anonymous channel. It's important to make it possible for those who are not safe, are not feeling safe to speak it out loud or speak it by face. That's it.
Thank you. Jonathan?
Thank you all.
I would echo what Luiz said. Additionally, I think it's critical for employees to know where the company stands, to know what you stand for. And that's why that commitment, point of view, comment that I shared at the end was invaluable. Just start now. This is an ongoing journey, but you need to put down what it is your organization stands for. And that's what enables us to have conversations about why mental health matters. We're not just now embarking on addressing stigma, but we're trying to create a supportive culture. And the efforts that we've made are what enables employees to trust us and have a conversation and trust one another, support one another, and identify those resources that are available to them, both anonymously, but also within the organization as appropriate.
Thank you very much. Well, we come to the end now. I want to really thank our three presenters for a fantastic presentation. Thank you for everyone who's been asking questions and joining the debate online. And just to remind you that our Global Healthy Workplace Award application process is open. So we're looking at quite a few coming in already, and we're looking forward to your applications. We still hope to host the summit in Washington in November. Watch your space. We're all being realistic about that, but that's still the intention. And I think when Jonathan was saying earlier about how kind of we're all feeling a little more, we're aging over the last few months. I certainly think I've personally aged about 3 years and 3 months, and that was kind of something that chimed with me. But this has been a terrific talk. Yeah. Thank you very much indeed. And we'll be following up with you very shortly. And if you have thoughts on future discussions, we would love to hear from you. Mo, I don't know if you want to add anything.
No, that's fine. Thanks again to the speakers, and thanks to Barry and to you, Tommy, too, as well. So thanks, everybody. Appreciate it.
Thank you.
Thanks.
Bye-bye.
Thank you.
Talk to you soon.
Bye-bye. Bye.